We performed a systematic review and also a meta-analysis of a topic that, in my opinion, is poorly defined in literature, because the clinical therapeutic profile is poorly defined, although this is a new entity that has been described in recent literature. So we performed, according to PRISMA guidelines, a systematic review, and then we pulled our results in a meta-analysis software from Meta3, and we obtained from systematic review a clinical profile of these patients. From a demographic point of view, we obtained that these patients could have a monophasic course other than AQP4-positive neuromyelitis optica spectrum disorder that are previously described as relapsing course, and a female-male ratio of 2:1, so pretty prevalence on female than male. On the other hand, from a clinical point of view, we obtained that these patients at onset demonstrated isolated optica neuritis or transverse myelitis or LETM, successfully obtained after inclusion of studies that have, according to different guidelines, to detect brain MRI changes and so on. So we obtained that about half of these patients have cervicothorax lesions on spinal cord changes, and on brain MRI we obtained that only 11% of patients have tumefactive lesions. About 80% have no changes at onset on MRI. We also obtained data from CSF analysis on, for example, my patients had pleocytosis or CSF oligoclonal bands, measured then in MOGAD pathologies, but pretty similar to AQP4-positive neuromyelitis optica spectrum disorders. From meta-analysis, we obtained also mean annualized relapse ratio of these patients, and we obtained also subgroups on late onset, early onset and late onset patients, and we observed that late onset patients had higher mean annualized relapse ratio than early onset, and then we compared these results with MOGAD or MOG-associated DN-NMOSD and AQP4-positive. We obtained a clinical therapeutic profile, an outcome profile similar to AQP4-positive, but worse than MOG-associated disease. So we obtained also data from treatment outcome, but data at the moment are very, very preliminary. So we also suggest that disease-modifying drugs such as mycophenolate or rituximab are important in reducing the mean annualized relapse ratio of this patient than other diseases such as AQP4-positive. In this moment, the literature is based on classify these patients according to different trials that making the results very, very preliminary and heterogeneous. We found also an E-squared of 98% that represent the heterogeneity of studies that we include in our meta-analysis. So, for example, there are only 2 or 3 trials on different treatments currently in the literature, such as tocilizumab or rituximab or other immunosuppressants such as mycophenolate, methotrexate, or azathioprine. So it's very heterogeneous, the treatment, but we have no data that demonstrated the real efficacy in a real clinical setting in this patient. So we need further investigations about this topic.